What's going on, everyone? Happy Friday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a test for any of the viruses that can make us sick, I hope you have tested negative. If you did test positive for any of the viruses, including COVID, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Friday edition of the Virus Update for Friday, May 30th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of viruses out there, and you need to be informed with what's going on with these viruses. That's what I do here on my channel each and every day. I give you the latest news and data to help keep you safe and informed of what's going on. Want to stay informed? Subscribe to my channel down below. Give this video a thumbs up, hit that notification bell, share this video with anyone you know. Help me reach my end of year goal of 10,000 subscribers. And of course, leave your comments down below. Already, we do have several news stories to talk about today, some daily data, and some new data from the CDC. You've been hearing us talk a lot lately about, or me, I should say. I'm a one-man show that runs this channel. You've heard me talk a lot lately about this guy right here, the NB.1.8.1 variants. Well, I don't know if we'll be able to go state by state for every state, but we're going to probably start seeing more news stories pop up about it, and we got one today. A new COVID variant is being found in Washington, and that is this new NB.1.8.1. Hard to say if that's going to be the one that goes dominant as we head into the summer for the United States. There's a couple variants out there, but this variant is now being found. It's a subvariant of the Omicron family. Is being found in Washington right now. It's the same variant that's responsible for rises over in much of Asia. It's the same variant that's responsible for what's going on right now in Australia. Australia is starting to go up for COVID, but yes, it's starting to show up here in the United States. It has not made the CDC Nowcast page yet. We'll take a look at the CDC Nowcast page later on in this video, and I suspect we may see a story about this or one of the other variants that are out there for New York State in the near future. We'll see. I'm going to keep my eyes out there. One of my searches, when I do my searches, whether it be Google, Bing, or whatever it is, or even just X, is COVID variants or new COVID variant. In measles news, in Burke County, North Dakota, yes, there is another case of measles. You know, North Dakota is really going in the wrong direction. Just a few weeks ago, they had 0 cases, then 1, then 2, then 4, then 10. Now North Dakota is up to 28 cases. This is not one of the more populated states, so I'm really concerned at what's going on here. Hopefully, we get to the bottom of this as we come into the near future, because this is really so concerning. And while we're at it, let's take a look at the new measles update for Texas today. I was going to do this later, but let's just do it now. The Texas Department of Health Services is reporting an outbreak of measles primarily in West Texas. And guess what? They have added more cases of measles. Yes, 738 now. Remember the other day it was just 1 added? Today they added 9. So now just when you think it's slowing down, it can go right back up. So 9 cases of measles reported since the May 27th update. And let's take a look at some counties here. Dawson County now has 26 cases, Ector 11, El Paso 57, Gaines County 409 cases, Lamar County 20 cases, Lubbock is now up to 53 cases. So yes, just when you think things are slowing down in Texas, and they start to go back up again. 701 of the cases are unknown or unvaccinated status, 1 dose of vaccine, 18 cases, and 2+ doses, 19. So the majority are still in the unknown or unvaccinated category. And since we're at it, let's go with the CDC update today. The CDC says the United States has now had 1,088 confirmed cases of measles this year, reported by 33 jurisdictions. Hey, we're starting to fill in more states here. Will we fill in all 50 states? It is quite possible at this point. There have been 14 outbreaks reported out of this. And in the age groups under 5 years old, 322 cases. 5 to 19 years old, 407 cases. 20+ years old, 349 cases. And age unknown is just 1% with 10 cases. Get this. Unvaccinated or unknown status still at 96%, but one MMR dose is now 2% of the cases, and 2 doses of vaccine, that's now 3% of the cases. So, yeah, the number of vaccinated cases has gone up slightly, but the vast majority are still in the unvaccinated population. Moving on to this now, from Dennis the COVID info guy. COVID-19 outbreaks in Australian residential aged care facilities up to May 29th. Active cases, 1,218. Hey, that's a big increase. 54.5%. Active outbreaks, 173. That's up by 47.8%. Residents, 903. Up by 55.6%. Staff members, positive for COVID, 315. That's up by 51.4%. Reported deaths in 2025, 157, and that is up by 6. So, yes, not good since the start of the pandemic in Australia. 7,361 aged care COVID deaths have been reported. That's a sad and high number. In 2020, 686. 2021, 226. 2022, we're in the Omicron era now, where Omicron spreads like a wildfire. 3,855 reported deaths, 1,359 in 2023, 1,078 in 2024, and 157 in 2025. One would think that based on what's going on, they're headed towards a less harsh year when it comes to death. But remember, they just added 6. We'll see. Can they do less deaths than 2020? I don't think they're going to do less deaths than 2021. It'll probably be higher because, remember, cases are still rising and deaths are the last lagging indicator. So, yes, there's your update on aged care facilities in Australia. All right, Kansas, dust in the wind, carry on my wayward son. Well, they're not carrying on right now. Kansas was set to do a show in Ontario, and apparently they are dealing with some sort of illness within the band, and because of that, they are postponing the show. A lot of these bands that were big in the late 60s, 70s, 80s, these classic rock bands, a lot of them just continue chugging on. And you know what? It's taking a toll on them. I mean, they're getting up there in age. COVID's still out there. Other viruses are out there. There's a lot of illness going around. It is really taking a toll on these musicians. Some have retired, but there's some that feel, we're just going to keep on going. I don't know of anything about Kansas doing a farewell tour. I know the Who is saying that's it. They're going to do a farewell tour. Although the Who did it before, back in, I think it was in the 80s. They said, we're going to go farewell, goodbye. And, well, here they are. They're still out there performing. So we'll see what happens. You got people such as Neil Young. I don't think he's doing indoor shows anymore. He'll do some outdoor shows, but not indoor. Some are aware and informed. After all, his good friend, David Crosby, did die from complications of long COVID. I remember it clear as day. His wife said long COVID was part of the reason for his death. So, yes, these rock and roll bands, musicians in general, continue to go on. Performers continue to go on. And they keep getting struck with illness. I'll make sure this one makes it to the thread over on my site of list of performers sick, because it is a growing list. All right, cases of whooping cough rising in Arizona. Arizona continues to have problems with whooping cough. Arizona has seen an 80% increase compared to the same time last year, according to the Arizona Department of Health Services. Yes, this is not good. And I should have wrote down the exact number from this video. I did not do that. Maybe I'll make sure I get that for you tomorrow. I'll make a note for myself. Hey, get the exact number of cases for Arizona tomorrow. All right, in Ventura County, California, at least I believe this is California, valley fever is surging. And there's a virus. Have I ever mentioned that before on the channel? I may have once, but valley fever is going up. The county's cases more than double 2024's pace. In most infections, there is no sign of illness. Groups at higher risk include firefighters. So yes, there is a surge of valley fever, which is going up in Ventura County. And if you want to learn more about valley fever, I'm sure the CDC has a page for that, or you can Google search it and probably some AI response would come up and it would give you all the different things to look out for when it comes to valley fever. Plus, I will today have a post, whether it be now or maybe later in the day, probably this evening, because I'm going out to work this evening. I will have a post with all the news stories for today, and you can read fully about what can happen with valley fever. It can actually get quite serious. COVID-19 over in Italy. Haven't talked about Italy in a while, but it looks like this is updated information, finally. 986 cases over the last 30 days. Remember, Italy, just like everywhere in the world, or most places in the world, is a victim to these at-home tests. So because of that, I know we've been using this same box to give you examples of that for probably well over a year now, but it really is true. It's making these numbers look a lot lower than what they really could potentially be. So 986 cases reported in Italy, 15 of them among healthcare workers. Median age is 66 years old. 46.1% are males. 53.9% are females. 20 deaths reported in the last 30 days. And 389 people recovered in the last 30 days. The UK. We'll take a look at more stuff from the UK over the weekend. That did update yesterday. And you know what? Real quickly, I'll show you the cases. In case you did not see yesterday's video, the UK this week reports 1,001 new cases. That's down by 129. Deaths, 73. That's down by 28. Patients admitted to the hospital, 1,043. And their positivity rate at this time, I believe it's 5.5%. It's coming up 5.47%. We'll take a look at some more data from the UK over the weekend on whichever day is going to be the slower day. Maybe that'll be Sunday. Canada, COVID-19 viral activity level in wastewater is moderate. Flu A is low. Flu B is moderate. RSV is low at this time. Hey, my website, datareport.info. It is full of information. Do you want to see news stories from past virus updates that I shared? Well, I have a section here. It doesn't go back to the beginning of the virus update, but there's quite a few of the virus updates are in here. I would say dozens of them. And you can see some past news stories. Maybe you're trying to research something. We also have on the website, this is very important to me, COVID studies and papers. You can find out about different things about COVID, maybe something that past variant did. Remember, variants of COVID. Each of them can do different things. We don't even know much about these variants until it's too late half the time. So you want to find out different things that COVID can do or has done in the past. Maybe your new health problem you think could be COVID related. Go check out the archive there. Alrighty, taking a look at what's going on with air quality today in the United States. And you're going to see there are quite a few areas that are dealing with problems today if this ever lows. Yeah, take a look at this. Not just the United States. Look at Canada. That's got to be wildfire related. You know, I'm just seeing this now. Wow, that's really bad. So we're going to have to keep an eye on that because, as you know, if you've been following this channel long enough, as you know, I am, one thing I take an interest in is weather. And when the jet stream is positioned in the correct direction when we're dealing with smoke, what starts in one place could end up in another place. We really need to keep an eye on this because Alberta, Canada, to the east of there, even into the Great Lakes here in the United States, if the winds are favorable, that could spread into the United States, and we could be dealing with some really nasty, severe air quality problems. We're already dealing with some in California. The Gulf Coast has a few problems. Mexico has a few problems. The East Coast states are dealing with a few problems. But you know what? That's nothing. If that wildfire smoke, I'm assuming that's wildfires. If that spreads in the United States, we could be dealing with widespread issues. Taking a look at pollen levels today. Why don't we? Why not? We haven't done it in a while. We do have moderate tree pollen issues, moderate to high, generally across the northern states. Some of those states that were late to seeing their trees budding, like New England, yeah, it's starting to show up there. And then you got the northern plains, the Great Lakes, and the northwestern states as well. Heat-related illnesses. I did refresh this, and we're going to be watching this. This is going to be expanding more to the north as we get into next week because things are really going to be heating up. In fact, this time next week, portions of the Mid-Atlantic region could be getting near 90 degrees. That's more than enough to cause heat-related issues. And let me say something. I think I've asked this on X before. I've seen people talk about it. A lot of people who have had COVID, including myself, have a change in tolerance to temperatures. Like, for example, for me, I'm an avid fisherman. Now, I don't get out as fishing as much as I would like to, but I went ice fishing twice this past winter. And one of the days, it was not all that cold out. And it was like, well, what the heck? I've been ice fishing long before COVID pandemic started, and I got cold constantly. And the first time it was colder out, and it hit me hard. And then vice versa, when the heat comes, my tolerance to the heat, it's not so well. There's a lot of people dealing with this problem where they just can't handle temperatures, and it's long COVID related, no doubt about it. So, yeah, this is going to be a problem. I think we're going to see a lot of heat illness related issues popping up over the next couple of weeks. All right, moving on to EMS calls. Pinellas County, Florida. We got a few calls going on there. Not terribly busy. That's good. Hey, Philadelphia, only 738 EMS calls yesterday. That's not bad. Taking a look at what's going on in Montgomery County right now. I need to refresh this. Okay, that is up to date. Hey, that's good. Only 10 calls right now. And in Chester County, PA, not too bad there as well. Fingers crossed with this one. Let's check the hospitals in Pennsylvania. If you saw yesterday's video, you saw Pennsylvania had a really bad day yesterday. And guess what? Today is somewhat better. Still some hospitals dealing with problems, but not as many as yesterday. New Jersey does have, I think, at least one hospital that's dealing with a problem. And let me refresh this. Maybe that hospital's gone now. Take a look at this. All in the green in New Jersey. Double thumbs up. That is fantastic news to see that in New Jersey. All right, Walgreens this week. The positivity rate was 15.6% for COVID. Up slightly. Testing was down. All right, New York State, this is not good. There have been some indications that maybe one of these new variants is about to take over in New York State. I've seen a few say it on X. That's where I'm getting that from. New York City was added in, and 585 new cases today. So there's that number. When's the last time they had that many cases? We have to go all the way back to May 5th. So, yeah, the highest since the start of the month. Bad sign. That's definitely something we'll be keeping an eye on. Taking a look at what's going on with hospitalizations there. 336 and 42 people in the ICU. Also, we need to take a look at Mid-Hudson Valley. Remember, they had an increase yesterday? Hey, they're lower today. 46 people in the hospital and 3 in the ICU. Here's the variant update from the CDC. We did not get it last week. We got it today. 73% of the cases is LP.8.1. They did not add any of those new variants yet. NB.1.8.1 is not on here yet. Could be a case where in the next update it just randomly appears, and it appears maybe over 10% or something like that. So it's something we'll have to keep watching. XFC is 10% at this point. Taking a look at what is going on with wastewater, and did this update? I'm going to refresh this again. We can see here. Yes, I believe this did update. Still just 2 red sites, and they're not in the same places today. I'm seeing one in Texas, not seeing where the other one is. Is it out on the West Coast? We'll do a full investigation of this over the weekend. In case you're wondering, red means highest level for COVID being detected in wastewater. Hey, I got some good news. Take a look at this. This is all the regions for, let's see, yeah, this is COVID. All the regions, and take a look at this. For the most part, all the regions did drop this week for COVID. The national, Midwest, South, Northeast, and West Coast did drop. Now, if we could see Puerto Rico, that probably would show an upward trend. All right, taking a look at this. Epidemic status. Likely growing now in Massachusetts. That's a surprise. Likely growing in North Carolina, Tennessee, California, and is growing now in Washington and Florida, and it's still likely declining, or not changing in many states. We'll take a look at these states, and we'll do what we did last weekend. Over the weekend, we'll take a look at them for wastewater as well. Emergency department visits. That's starting to slow its drop now. And I think pretty soon we're going to gradually start to see that going up as we get into the month of June, and probably as we head into summer. It definitely will rise. Will it get higher than what we saw in the winter, or hopefully not as high as last summer? Well, we'll just have to wait and see how that goes. Alrighty, folks, that does it for the Friday edition of the Virus Update. If you like today's update, give this a thumbs up. Subscribe down below. Hit that notification bell. Share this video with anyone you know. Leave your comments down below. And hey, if you find a news story that maybe didn't make the Virus Update that you think should, as long as it's a credible source, send me email datareport@gmail.com. That's the channel's email address. Or send me a direct message over on X, Blue Sky, or even over on Facebook at Data Report there. And who knows, maybe I will share that news story on a future virus update. I'm always up for, if anyone finds something that should make the videos, tell me about it. Alrighty, folks, I will see everyone again tomorrow. We will have updates all weekend long. Until I see you again tomorrow, stay safe, everyone, and have a fantastic Friday evening. Thanks for watching.